Whether you are deep into medical research or maybe exploring complementary therapies for a loved one or just, insanely curious about the mind-body connection, you are in exactly the right place.
Absolutely.
Because today's deep dive is tailored perfectly for you. We are looking at a space that doesn't usually get a lot of mainstream attention, but has completely captivated me.
It's a fascinating area.
It really is. Our mission today is to explore this incredible intersection where ancient spiritual rituals meet modern clinical oncology. We are pulling from a paper titled Plant-Based Rituals for Psychospiritual Healing in Cancer Care, authored by Dr. Akyut Saroj and Dr. Minu Jain.
Right.
And we're going to look at how a few simple, natural elements might be doing a lot more heavy lifting in the healing process than we ever really gave them credit for.
It is a remarkable paper
Oh.
because it establishes this core premise that we often forget in modern medicine. In cancer care, healing isn't just about the physical body.
Right, it's more than just the biology.
Exactly. It is deeply about the psychospiritual experience. We are exploring how pure plant-based body products, things like oils, balms, salves, and washes, actually influence stress physiology, immune regulation, and emotional resilience.
I have to admit, when I first read the premise, I was a little skeptical.
I think a lot of people are.
Yeah, I mean, modern oncology is so heavily focused on aggressive, targeted therapies, radiation, chemotherapy, immunotherapy.
Hardcore science.
Right. So how do, softer concepts like spiritual rituals or plant balms even find a foothold in that kind of hardcore clinical environment?
That is the exact tension this paper addresses.
Yeah.
To understand how these tools are being used today, we actually have to step outside the modern hospital and rewind the clock,
Okay.
because this isn't some new wellness trend.
Yeah.
The historical evidence here is staggering. We are talking about a global heritage of using plant-based fragrances for both spiritual and physical healing.
The paper runs through this map of ancient practices, and it's just amazing how universal this is. Let's look at ancient India first.
Good place to start.
Within Ayurveda, there's this long history of using fragrant oils like sandalwood, tulsi, and jasmine for something called apyanga.
Which is a specific type of oil massage.
Exactly. And the ancient text, the Charaka Samhita, talks about using these oils to balance doshas and calm the mind. But what does balancing a dosha actually mean in practical terms?
Think of doshas as the body's operating system in Ayurvedic medicine. They represent different energies or biological functions.
Okay, that makes sense.
When you are sick, that operating system is crashing or severely out of balance. So the application of sandalwood or tulsi wasn't just about smelling pleasant. It was a targeted therapy designed to reboot that system, lower the temperature of the body's stress, and bring the patient back to a baseline of calm.
And while that was happening in India, you have entirely different cultures discovering similar properties.
Absolutely.
You look at ancient Egypt, and the priests were using myrrh, frankincense, and lotus oil. We usually associate that with embalming in the afterlife, right?
We do, but the archaeological evidence shows it was far more practical than just afterlife symbolism.
Oh, really?
Yeah, the Egyptians actually recognized the literal antibacterial and preserving properties of these resins. They used them for prayer rituals, yes, but also to protect the physical body from decay and infection.
That is wild. And then you cross over to traditional Chinese medicine where they were burning or applying aromatic herbs like camphor, ginger, and mugwort.
Right, to unblock stagnation.
Right, to support the flow of qi. Now, I've heard the term qi before, but how does an aromatic herb actually influence it?
In traditional Chinese medicine, they focus on qi. Think of it as the body's energetic highway. When traffic jams happen on that highway, you get disease, pain, and emotional distress.
So the herbs act like a traffic cop.
Basically. They used highly stimulating aromatics like camphor and ginger to clear the traffic. The strong scent and the physical warmth of those herbs were believed to break up stagnation and get the energy moving again.
It just keeps going across the globe. You look at indigenous traditions where sage, cedar, and palo santo were used in smudging and healing salves for grounding and purification ceremonies.
And early Christianity, too.
Yes. Anointing with oils like spikenard and frankincense was a massive symbol of healing and divine grace.
Yeah.
It feels like this universal human instinct. Across completely isolated cultures, humans instinctively reach for fragrant plants when someone was suffering.
What's fascinating here is that this isn't just nice-smelling history. This ancient global consensus forms the literal foundation of modern clinical aromatherapy.
So it's not just historical curiosity anymore.
Not at all. This ancient wisdom is now officially recognized by modern medical organizations. Groups like the American Holistic Nurses Association officially recognize clinical aromatherapy for its direct role in reducing anxiety, pain, and spiritual distress in cancer care.
Yeah.
It's the translation of ancient ritual into a recognized clinical tool.
Which brings us to a profound concept from the text that really stopped me in my
The
tracks.
reframing of the body.
Yes, this idea of reframing the body. When a person is going through intense medical treatments, getting poked, prodded, scanned, and infused with harsh chemicals, it is so easy to view the physical body as a site of disease, a battlefield, basically.
It is a tragic but very common psychological side effect of cancer treatment. The patient becomes alienated from their own physical form.
It becomes the enemy.
Exactly. But this paper argues that ritualized self-care, using these natural elements, helps patients view their body instead as a sacred vessel. The authors use the term Atman, or divine essence.
It completely changes the relationship you have with your own physical form. Instead of a war zone, the body becomes a temple that requires gentle tending.
It's a vital psychological shift.
Okay, let's unpack this with a real-world application, because I know you, listening to this, might be wondering what this actually looks like in a modern, sterile hospital room. The authors point to a pilot study done at Memorial Sloan Kettering, one of the premier cancer centers in the world.
A very clinical setting.
Highly clinical. They took cancer patients who were actively undergoing chemotherapy, and they introduced aromatherapy massage using lavender oil.
And we have to picture that environment. A chemo ward is characterized by the beeping of monitors, the smell of clinical antiseptics, and a profound sense of coldness.
It can be very intimidating.
Very. Introducing a warm, fragrant lavender massage into that specific environment is a massive sensory disruption. The researchers found that this intervention significantly reduced anxiety and improved the overall mood of these patients right in the middle of their treatment.
But is it just the fact that someone is rubbing their shoulders, or is there something more to it?
Well, the text highlights a crucial variable identified by researchers studying psycho-oncology, and that is meaning.
Meaning.
Yes. They found that self-care rituals involving touch actively reduce distress and improve body image, but only when that touch is tied to spiritual or cultural meaning.
So it isn't just the mechanics of the physical massage.
No, it's the intention behind it. When the patient perceives the touch as a sacred or deeply respectful act, the psychological benefits multiply.
Here's where it gets really interesting, because obviously a massage with lavender oil feels good, but the paper dives into the hard science of what is actually happening under the skin. Are these oils physically doing something to the body, or is it purely a psychological comfort?
It is absolutely physical. Organic plant oils, things like sandalwood, tulsi, neem, lavender, frankincense, possess literal bioactive compounds.
Bioactive meaning they interact with our biology.
Precisely. When researchers analyzed the science of aromatherapy, they found that these compounds have proven anti-inflammatory, anxiolytic, which means anti-anxiety, and neuroprotective effects.
Wow.
You are physically putting medicine on the skin absorbs these compounds, and they enter the bloodstream.
So the plant itself is doing biochemical work, but the paper also talks a lot about the rituals accompanying the oils, things like meditation or chanting mantras. How does chanting actually change the biological state of someone with cancer?
This is where we look at gene expression. Researchers actually looked at what happens on a genetic level when patients engage in meditation and mantra chanting. Think of your genes like dimmer switches.
Okay, dimmer switches.
The massive stress of cancer and chemotherapy turns the inflammation switch all the way up, and it turns the immune defense switch down. What the data shows is that chanting and meditation actually reach in and turn that inflammation switch back down.
Wait, so chanting isn't just a psychological distraction, it's actually altering the body's physical stress response.
It is. The practice resulted in lower cortisol levels, cortisol being the primary stress hormone that ravages the body over time, and it improved immune modulation.
That is incredible.
Your body's stress response is quite literally rewritten at a cellular level.
Yeah.
And when you combine that grounded state of mind with the bioactive compounds from the oils we just talked about, the clinical outcomes are highly significant.
It's a double effect.
Exactly. For instance, in controlled trials, lavender aromatherapy didn't just casually help. It measurably improved sleep quality and reduced chemo-induced anxiety to a significant degree.
That makes a lot of sense when you think about how our brains process these experiences. The paper brings in insights from trauma experts about how sensory rituals offer trauma-informed care. They talk about limbic calming. Can you break down what the limbic system is doing when a patient smells these oils?
The limbic system is a primitive part of our brain that governs emotion, memory, and survival instincts. It's our alarm center.
The fight-or-flight center.
Right. When a cancer patient is in a hospital, their limbic system is constantly sounding the alarm. Danger, pain, fear. What is unique about our sense of smell is that it has a direct, unfiltered pathway to the limbic system. It bypasses the logical, thinking part of the brain entirely.
So you can't just talk yourself out of being terrified in a hospital bed.
Exactly. Logic doesn't work well on a panicked limbic system.
Mhm.
But when you introduce a familiar, grounding aroma like sandalwood or cedar, you send a direct chemical message to the brain's safety center.
You are activating limbic calming.
Yes. When researchers look at neuroimaging during sense stimulation with pleasant smells, they see activation in the exact brain regions associated with positive emotion, resilience, and autobiographical memory. It acts as a cognitive behavioral anchor.
So you take an anxious spiral and you replace it with repetitive, calming sensory input.
That's the exact mechanism.
And what I love about this paper is how inclusive this concept is. They point out that this neurobiological benefit isn't exclusively for people who follow a specific religion. They mention the SBNR demographic spiritual, but not religious.
A very large demographic today.
Right. For you, if you fall into that category, simply pairing a body ritual, like applying an aroma, with intention setting or a guided meditation, provides comparable neurological benefits to formal prayer.
The biology responds to the intention and the sensory input, regardless of the specific theological framework.
Though for those who do have a specific framework, the integration is incredibly deep. The authors note that using something like the Maha Mriti Jaya mantra, a traditional Hindu healing chant, provides deep emotional anchoring.
Yes.
When you couple that chanting with the physical application of tulsi oil, you create a multisensory healing ritual. You are engaging the auditory system with the chant, the tactile system with the touch, and the olfactory system with the scent, all at the exact same time.
It leaves very little room in the brain for anxiety to take hold.
If these rituals are this powerful for the patient's brain, what is it doing to the person actually applying the oil? The caregivers are in the room experiencing this too.
That is a crucial part of the equation.
The paper shines a massive spotlight on the people providing the care. Because when a patient is suffering deeply, words can sometimes feel completely hollow, or a caregiver might feel totally helpless, like they don't know what to say.
In clinical spiritual care, nonverbal language becomes paramount. Acts like applying a balm or gently anointing a patient's feet with oil convey profound presence and spiritual companionship without requiring a single spoken word.
It bridges the gap when language fails.
It does.
The clinical reflections the authors share in the paper are just beautiful. They describe a Hindu caregiver offering a tulsi balm to a patient while silently chanting Tivameva Mata, which is a prayer of surrender and connection. Or a Buddhist caregiver using rose water as a mindfulness practice to wash away suffering.
These aren't just medical tasks to check off a list, they are profound moments of connection.
And again, there is a biological mechanism underpinning that connection. It isn't just poetry, it's physiology. Research into nursing ethics and touch shows that this kind of spiritual touch actually increases oxytocin levels in the bloodstream.
Oxytocin is the bonding hormone.
Right, the one associated with mothers and babies.
Yes, it is the hormone of trust, safety, and connection. When a caregiver applies these balms with intention, it creates an oxytocin loop.
A loop between the two of them.
Exactly. It supports a deep caregiver-patient bond and fosters emotional regulation for both parties. It is a shared biochemical event. Studies looking at aromatherapy massage in palliative care settings have found that it leads to significant reductions not only in patient-reported anxiety, but also in caregiver stress.
It's a two-way street of healing. The caregiver is pouring from their cup to help the patient, but the ritual itself is refilling the caregiver's cup at the exact same time.
It's a beautiful synergy.
So what does this all mean when it comes down to actually choosing the products we use? Because the authors make a very strong point that the sourcing of these oils and balms matters immensely. I imagine you can't just grab a cheap synthetic lavender lotion off the pharmacy shelf and expect the same psychospiritual result.
That is a critical distinction in the paper. The authors introduce the concept of eco-spiritual integrity.
Eco-spiritual integrity.
Yes. For many patients, particularly Hindu and Buddhist patients, their dharma, their cosmic law or deeply held duty, includes the principle of ahimsa, which translates to non-harm. It also includes purity, or being sattvic, and having a deep reverence for the environment. So choosing organic, cruelty-free, and ethically sourced products isn't just a lifestyle preference or a luxury. For these patients, it is a strict spiritual requirement.
Because if you are trying to heal your spiritual distress, but the physical product you're using to do that violates your core beliefs, you are essentially just creating a new psychological burden.
Exactly. Imagine a patient who has spent their entire life practicing nonviolence and environmental stewardship. If they are in a vulnerable state in a hospital and they are treated with products that were tested on animals or synthetically manufactured in a way that harms the earth, it can cause severe internal conflict.
That makes perfect sense.
The authors present a very real clinical note. Patients may outright refuse products that are not sadific or that violate their ecological ethics, and if they feel forced to use them, it can cause active harm.
I would imagine the guilt of compromising your ethics while you are already fighting a life-threatening illness would be incredibly heavy.
It is. Research shows that providing faith-congruent products actively reduces existential anxiety and guilt in patients whose worldview includes karmic ethics or creation care. When the care aligns with their deepest values, the healing potential is maximized.
And the data backs up just how widespread this desire is. The paper references a massive survey done at MD Anderson Cancer Center. They found that 61% of cancer patients preferred integrative products that aligned with their ethical or spiritual beliefs.
That is a huge number.
61%. That is well over half the hospital population. The patients specifically noted that having those ethically aligned products reduced their guilt and enhanced their sense of personal integrity. It gave them a sense of control during a time when they felt like they were losing control over every other aspect of their lives and their bodies.
It underscores that providing eco-conscious, ethically sourced options isn't just pandering to a niche demographic. It is a vital, evidence-based component of preventing spiritual distress in a clinical setting.
It really changes how you view everything sitting in your medicine cabinet right now. To synthesize all of this for you listening, the core message of this deep dive is that organic, plant-based body care is so much more than skin deep.
Much more.
It is, as the authors say, a spiritual witness. It is a bridge between the sacred and the sensory, rooted in thousands of years of human history and now totally validated by modern neurobiology.
Validated by hard science.
Yes, whether you are a patient currently navigating the harsh realities of treatment, a survivor trying to reconnect with a body that feels unfamiliar, or a caregiver who feels like they are running on empty, these evidence-based rituals offer real, tangible moments of grace. It is about treating the human being, not just the diagnosis.
The authors conclude their paper with a thought that perfectly captures this synthesis. They write, "Let every balm become a blessing. Let every oil be a reminder. The body may suffer, but the spirit remains fragrant and whole."
The spirit remains fragrant and whole. That is incredibly powerful.
It is beautifully stated, and this raises an important question, something we should all consider long after this discussion ends. If human neurobiology, immune response, and spiritual resilience are so deeply and empirically tied to familiar, natural sense and comforting, meaningful touch, how much healing potential are we accidentally blocking with our modern obsession with completely sterile, perfectly unscented clinical hospital environments? What if the highly effective hospitals of the future are designed to smell and feel a little more like ancient temples?